This is Talk Business and Politics with Roby Brock.
And welcome to the program. I'm Roby Brock. We are glad to have you with us. Last week, our State of the State Executive Roundtable took a look at some of the things that landed us where it did at the end of 2021. Today, we look forward into 2022 and what expectations are. Dr. Joe Thompson, Shannon Newton, and Sylvester Smith were my guests at the Executive Roundtable. We've seen a federal infrastructure package pass. We have seen the state make an investment in large part thanks to your leadership and the trucking industry's leadership in a highway plan that is finally starting to put some orange barrels on the roads out there. What are your expectations for how infrastructure investment can make a difference, not only for your industry, but for the overall economy?
I do think that perhaps in amongst the other headlines, the accomplishment and the significance of the infrastructure bill that recently passed may have been a little bit lost just in the shuffle of other competing headlines. I do think that you're going to see, money faucets are going to flow. As soon as that money is appropriated, you're going to see historic levels of funding become available for road, transit, and a lot of other modes of transportation. And so I think there's going to be a little bit of a push here initially in 2022 to see, are there places where that money could be spent immediately to have any sort of meaningful impact on the supply chain crisis or crunch that we're currently experiencing? Are there ways to invest in ports or in technology to help the modes communicate better with one another? I think that's probably the most immediate opportunity for those funds to make an impact that would be felt by average consumers. But certainly just on a broader spectrum, if we're looking at a driver shortage, you asked about maybe some ways to address that or improve that that are available to us. And I think maximizing the driver's time in things other than sitting in congestion or taking out of route miles or waiting at a shipping or delivering facility. I think there's a report out now that says even though a driver can drive 11 hours, the average driver is actually driving about 7 hours of their available time a day because they're spending that other time in inefficient ways, whether it be created through infrastructure or those kind of wasted gray space in the supply chain where the modes are not communicating effectively together. And so hopefully there are some opportunities there to help maximize the time and efficiency of the drivers that we do have while looking at other ways to attract more individuals.
Yeah, a good point. Sylvester, infrastructure's got a lot of potential ramifications for folks you represent, particularly those small businesses we talked about. Number one, broadband into more rural communities is going to be a big part of this, but also just the spending itself leads to construction jobs, leads to service jobs, leads to more people needing to stay in hotels that are on the road building some of these projects and eating at some of those local restaurants and buying from some of those local vendors. How do you see infrastructure playing out for small businesses?
Well, I believe it's going to be a gift and a curse, Roby. On the one hand, if you're a hotel, some sort of service industry business in one of those areas where the dollars are being allocated, good for you. Your coffers will be full. However, to Shannon's point, it's also going to create a lot of jobs. And right now, Roby, I'm looking at, again, our Small Business Optimism Index, in which 48% of my members are saying they've got jobs they can't fill. And so that's only going to add additional pressure on our very limited labor force. And I hate to be the glass is half full guy. I mean, I like to be Mr. Hopeful and optimistic, but the truth of the matter is that's going to be a beautiful thing for us long term, but there's going to be significant short-term pain that we're going to have to deal with as we get to the light at the end of this economic influx tunnel. And so we kind of see that both ways. I would like to piggyback, though, on something Shannon said. This transition to goods going that extra mile, that's also created a lot of new entrepreneurs because people see the opportunity to start a small courier service or delivery company. And some of those folks typically would have been workers that would have worked for the people we represent. And now they're taking the opportunity to work for themselves. And so our economy is shifting, and that's a beautiful thing for our country. And it's an exciting thing for these new entrepreneurs. I think we've just all got to pick up a role and figure out how do we take this change and turn it into a net positive for everybody.
All right. So what I hear you saying, Sylvester, is that you're about to get into the drone delivery business. Is that what I hear you saying?
Hey, that's why you see this lovely gray backdrop, Roby. I'm at the drone factory right now, trying to get my minions together to get that thing launched.
Joe, you talked about healthcare infrastructure and public health infrastructure. I suspect broadband's a big part of that as well. But talk to me about how you see the infrastructure debate that's been taking place having some impact, and maybe even some things that aren't being addressed in terms of public health infrastructure that you alluded to earlier.
Well, I think a positive of the pandemic in the healthcare industry is it shook the industry to adopt technology that had been resistant to do before. During the initial pandemic, when clinics were closed and access points were restricted, we opened up the doors for telemedicine to allow the delivery of care where possible through telemedicine visits, through other activities. I think there will be a lot of pressure on doctors' offices not to have folks sitting in the office for 2 hours once they've experienced the ability to sit in their home and have the visit happen, via televideo situation. That does require, though, broadband access. And if we're going to avoid disparities for rural Arkansans or Arkansans in lower income communities, we're going to have to make sure and find a way to have affordable and accessible broadband access in those communities to allow the technology to deliver medicine across our state for all. I think some of the other technologies that we've gotten, the vaccine breakthrough here, I don't think it can be understated that the new technology of being able to profile a virus and the RNA fingerprint, if you will, of that virus or the spike protein of that virus, create a response and deliver it within a period of less than a year. That is a dramatic new technological advance. And we have some of the most effective and most safe vaccines than we've ever produced in the history, of vaccine production, back to Louis Pasteur and smallpox. So, I think some of those technologies will come through. And then I do think that folks are reassessing their own personal health habits because this has been so much of a threat. And hopefully we can get some folks to address some of the longstanding, chronic conditions and risk factors that they have that may rob them of a long and quality life expectancy.
For all of you, we will wrap up this conversation with everybody gets to make some crystal ball predictions. So we're at the beginning of 2022. Joe Thompson, I'm going to come to you first, then Shannon, then Sylvester. I want you to tell me, what are we going to be talking about at the end of 2022? And you can even be optimistic if you want to.
I will be as optimistic as possible here in January. I think we're going to have a rough January. I think we will come out of January and we will recognize that some of the strategies that we have employed, we need to identify ways that we can easily and rapidly employ them when we need, masks, requirements for vaccinations, other things, and that we can relinquish those when we don't need them. I think we're going to have advances and accelerations in the healthcare system. I think you're going to see changes in the way that doctors and hospitals are paid so that there is an investment in the resiliency of the healthcare system, not just the per unit provision of care in the healthcare system. And finally, I hope we have an ability to get beyond the misinformation and disinformation that has permeated our conversations, largely influenced by politics, and get back to where we're building a common understanding of how we work together to optimize the economic vitality and the quality of life that we all strive for our families.
All right, good and noble stuff there. Shannon, how about you?
Well, I will kind of focus on the economic indicators because that's something that is, that drives our industry. When the economy is doing well, our industry tends to do well. And when the economy is not doing well, the demand for our services declines. And so, I think the year for our industry is ultimately going to depend upon how the cycle of consumer spending trends. We've experienced a long period of economic recovery / growth. where there has been some organic and then additional, funds pumped into the economy, which has created this environment in which our industry has done really well and experienced, rate increases and margin increases, and has benefited from the experience of the economy. But if inflation or if pandemic circumstances, or if something, turns the tide on that consumer spending, I think that will determine, does this last the first 2 quarters? Does it extend into the third quarter? And then whenever that retraction of consumer spending does come, to what extent, does that impact the economy? Do we return to something normal, or do we face some sort of regression? And I don't know the answer to that question. In the meantime, our industry is going to continue to deal with this outpacing of demand, and do the best that we can with the resources that we have to move products safely and efficiently.
All right, Sylvester, at the end of 2022, what's going to be the half glass empty or half glass full picture that you're going to be looking at?
Well, it depends, Roby. I'm going to talk about the one thing the other two guests didn't, and that's politics. If you're a conservative in Arkansas or in our great nation, you're going to be very optimistic, because here in Arkansas at the end of 2022, we'll be working to swear in our first female governor, which will be Sarah Huckabee Sanders. The Republicans are going to sweep once again all of the statewide offices, all the congressional seats. And then nationally, I believe America will push back to the left-leaning policies of President Biden, Speaker Pelosi, and their liberal friends in the Senate. And we'll see Republicans retake the House and retake the Senate. And I'll be very hopeful that my compatriots in the Republican Party recognize that they'll be operating on a short leash in the Congress, and that they do something with these new majorities.
We'll see if that happens. The Democrats have not seemed to learn that they've got a short leash. We'll see if the Republicans know that too. So, all right, Dr. Joe Thompson, Shannon Newton, Sylvester Smith, thank you all for participating in our executive roundtables. Good information, and I appreciate you participating.
Thanks for having us.
Thank you.